So thank you all for being here. I think you know the program. We're going to have a keynote, and then right after that, we're going to have a one group presentation and then a second. And then we have a happy hour in our suite right after this, immediately following. We're in 701, so when you come off the main elevator, straight ahead is our office. So please join us there. There's actually two demonstrations. There's a new tech platform that we're migrating to that if you're interested to hear that. And then we actually have the PA Navigate demo up as well, that you can actually, navigate that and so forth. No pun intended there. So you may see a few of our board members start to come in here. I think some have already, but I wanted to recognize them. We would not be the organization we are without the leadership and experience in the room, and Val had a chance to meet with them just a few minutes ago. A very productive conversation, but many of these board members have been with us since the very, very beginning. So we're very grateful for all their involvement in helping us with HealthShare. And we are just celebrated our 12 years as an organization. So we're 12 years old just a few weeks ago. Also, and I see a few folks that are chairs and have been very active in our committees, and some of you are committee members, and some here, I think I saw Dr. Hessen over there, co-chair of our clinical advisory. These committees really drive our agenda. They really direct our priority and activity. So please know that there's a group of folks that are behind these committees that are really super helpful for us. So, and Dr. Finsky, I'm sorry, where's Karen? There she is, sorry, I didn't see you. And if there are there other chairs here that are up there? No, okay. But these committees really are critical to our success and so forth. Some of you may not know who we are. I'm not going to get into all kinds of detail here, but we are a nonprofit 501c3. We're a neutral party that's really a data hub, a data aggregator for clinical health data. But now today, in talking about PA Navigate, we're really going to start ingesting and taking in SDOH data. So this is kind of a whole new value proposition for us. We are tri-state. We can get through the maturity of the networks within the states. We can get to all data across Pennsylvania, across New Jersey, across Delaware, even nationally, right? A lot of the exchanges have matured to a point where we can really get to data anywhere that a patient may have been seen. And a lot of our information is real time, right? This is constantly getting enriched real time from many different health systems and really participants across the entire continuum of care. So just wanted to make sure you knew that. One of our services, about 7 million people are enrolled in, and they're being tracked 24/7, 365 days a year of all their interactions in real time, up to 15 minutes of where they are and where they're interacting with the healthcare system. Super valuable for care coordination and super valuable for some of the things we want to build on with PA Navigate that you're going to hear more about here in a minute. What I wanted to share here is if you think of PA Navigate as part of the puzzle that HealthShare is kind of piecing together, right? And if you think of, and you just go around this graphic a little bit, we have clinical data, physical health data. We're going to be collecting more SDOH data. We're supporting our members, right? There's public health and research that we can offer through this data hub, population health management that we can offer through this data hub, the PA Navigate, right, closing that referral loop and sharing more of that information ongoing, and then the social benefit programs, right, and monies that are available to support these patients, we can help broker and facilitate and automate much of that. So know that PA Navigate, it's a big part, but it's part of this puzzle that HealthShare is kind of building and piecing together to really enable kind of a complete data hub that can be super valuable for the community, right? We're a nonprofit, we're for you, right? This is a community entity that you all need to leverage, and we call it a community asset, right? That's what we're building here. And much of this is operational today, but we want to scale it, right? We want to grow this. So a couple challenges I'll leave you with, and then I'll introduce our keynote. We actually just mentioned this. We're still a secret in many regards, right? Some of you may not have heard of it until this event. So help us get the word out. As you learn more about us, get the word out that this is just a super valuable community asset that can offer so much value and potential from the data sharing and connectivity perspective. Know that we are your community asset, right? So if you have ideas on how to leverage this and want to use us, come to us, right? Figure this out and come to us. And we will work with you to kind of come up with a way that you can make sense of this information and this connectivity and do good, hopefully, for your patients. Ongoing financial sustainability. I just want to put that out there that yes, we are sustainable today, right? And this is something that we've paid a lot of attention to over the last several years. We continue to, but funding we know is always at risk. So we're continuing to have those conversations with the state. We actually talked to Val a little bit about this earlier, about the Medicaid waiver that I know a number of you are familiar with, and what's the HIE's role in that, and how can we be supportive in that and really help achieve some of these major initiatives that are out there that we think through data sharing could be super valuable. So anyway, I just wanted to share those things, and with that, I'm going to introduce Val here. So